Hi, I'm Miriam Cassius, a researcher at Children's Specialized Hospital. My colleague, Dr. Jen-Fu Cheng, and I recently published a study in the Journal of Developmental and Behavioral Pediatrics titled Children with Cerebral Palsy and Unmet Need for Care Coordination. Our interest stems from the fact that cerebral palsy is the most common movement disorder in children and refers to a group of permanent neurological disorders that affect body movement, posture, coordination, and balance. Children with CP often present with other neurological symptoms such as epilepsy, intellectual disability, behavior disorders, speech, vision, and hearing impairments. So therefore, CP is a developmental disability that can severely impact the health and functioning of children. Symptoms can be relatively mild or severe enough that the child is completely dependent on others to perform activities of daily living. The many comorbidities associated with the disorder result in higher rates of physical and behavioral healthcare utilization, as well as other services. Hence, coordination of care for this population is essential. The benefits of care coordination for children with special healthcare needs are well documented. Care coordination has been shown to improve quality of healthcare, decrease healthcare utilization and costs, and reduce hospitalization and emergency visits for children with chronic conditions like CP. While there is much research on children with complex medical needs, we found that there were very few nationally representative studies on the receipt of healthcare coordination for children with CP. So the aims of the study were to determine the proportion of children with CP with unmet need of care coordination. We also wanted to examine the physical and functional health of children with CP. And finally, we wanted to explore whether unmet need of care coordination differed by demographic characteristics and severity of CP. We analyzed pooled data from the 2016 to 2018 National Survey of Children's Health and included children and youth aged 3 to 17 years. Our research found that more than half of children with CP reported unmet need for care coordination, compared to 28% of children without CP. Children with CP also had higher odds of unmet need for care coordination. They had significantly higher odds of all of the health conditions that we examined. Notably, 1/5 of children with CP had behavioral or conduct problems, while only 7% of their peers without CP had the conditions, and 11% of children with CP had autism spectrum disorder compared to just 2.8% of their peers without CP. Functional disabilities were significantly more prevalent among children with CP, and those with mild CP had higher odds of unmet need than children who do not have CP. Additionally, odds of unmet need for care coordination were increased for children with moderate or severe CP. Inadequate prevention or delayed treatment for common disorders in children with CP can result in the later need for invasive, costly, and less effective treatments. Care coordination can decrease such preventable morbidity. Additionally, care coordination is important because the complex nature of CP requires a multidisciplinary approach to treatment. Given that CP is the most common cause of motor impairment in children and the heterogeneity in presentation, individualized care coordination for children with CP is critical for each child to reach their optimal level of functioning and quality of life.